Good evening, and thank you for joining us on this edition of the Nation Leadership Forum. My name is Zainab Ismail. Now, tonight, we'll be taking a look at the state of immunization in the wake of a global pandemic. Well, in July this year, the World Health Organization, together with UNICEF, warned of an alarming decline in the number of children receiving life-saving vaccines around the world, occasioned by disruptions in the delivery and uptake of immunization services caused by the COVID-19. Well, in essence, these disruptions have threatened to reverse hard-won progress to reach more people, which has already been hampered by a decade of stalling coverage. Now, to have this discussion with me tonight is Mr. Sami Ndungu, the head of Vaccine Sanofi Pasteur Eastern Africa, Dr. Mary Beth Maritim, an infectious disease and travel medicine expert, Dr. Evans Mukoye, the Deputy Director, Partnership and Collaboration at the Kenya Medical Research Institute, or KEMRI, as well as Dr. Rudy Eggers, the WHO Country Director. Thank you to the panelists for sparing time for this pertinent discussion. You can also be part of this conversation through our social media platforms at NTV Kenya, at Zainab Ismail. The hashtag is NMG Leadership Forum. Now, I'll begin with you, Mr. Sami. Now, briefly, just to get a better understanding of what really is a vaccine, how does it work, and how essential is it for the world population?
Thank you, Nejma, for the good introduction to the topic and to the situation that we face today. Vaccination and immunization has actually been signaled out as one of the greatest biomedical inventions in the past 100 years. How do vaccines work? Vaccines work by preparing the human body in advance by introducing either a weakened virus or bacteria that then enables the body to produce a specific protection, what you would call an immune response against an invasion of that bacteria or virus should it occur in real life. So it's a preparation in advance for an imminent infection should that occur.
Mm-hmm. And why exactly is it very important for the population globally?
Now, vaccines are very important because, of course, these bacteria and viruses cause severe disease. They may cause death. And indeed, in some cases, there is no treatment for certain conditions. And to date, these conditions have only been managed, they have only been controlled because of immunization. A good example is rabies, for instance. Rabies has no cure. Without a vaccine against rabies, the outcome of a rabies infection is almost always fatal, resulting in death. Polio is another good example. Today, there is no treatment for polio, and polio has nearly been eliminated. 99% of all cases of acute flaccid paralysis from polio have been eliminated only because and thanks to immunization. It's therefore, so immunizations save lives, without a doubt.
All right.
And that's why they are that important.
All right. Thanks, Mr. Sami. Now, Dr. Mary Beth, so, we understand that there are different types of vaccines that cater for different, the demographics that we have across the globe. Just take us through these vaccines and why they're important in adult and pediatric care as well.
For that question, and thank you for the invitation to this panel.
Right.
And when we think of vaccination, many of us only think of the vaccines that we give to the children. But vaccines are beneficial throughout the lifetime of an individual. There are vaccines that are useful in childhood. There are vaccines that we give to adolescents. And there are vaccines that are recommended for the older populations and the elderly. So, for example, many of us, and particularly the mothers who are listening to this, we normally take our children to the clinic, and the children receive vaccinations that are part of the national immunization schedule. So they receive these vaccines up to now the age of 18 months. and many of us think that the vaccines end at that age. But I want to use this opportunity to just let us know that there are very many vaccines that are recommended for other age groups. For example, now in the national program, there's a vaccine that is recommended for young girls. This is a vaccine that protects against the human papilloma virus that causes cancer of the cervix. So this is an important vaccine. Additionally, there are vaccines that should be given to children still within that age group. For example, the recommended schedule for example, tetanus vaccine should have boosters even in the age of 7 years and another booster at the age of 11 years. So when the children get the tetanus vaccine in early childhood, there are additional boosters that need to be given while the child is in primary school and even when the child is finishing primary school. So for some of us who maybe have not taken our children for these additional boosters, I think we should do that. Beyond that, there are additional vaccines that are useful for certain age groups within the adults. For example, for adults who have certain conditions, for example, if they have diabetes mellitus, if they have chronic lung disease, if they have known heart conditions or heart failure, then additional vaccines that protect against respiratory tract infections, for example, pneumococcal vaccines to protect against pneumonia caused by a bacteria, and then even influenza vaccines that should be given every year, are additional vaccines that protect these vulnerable groups from getting respiratory tract infections, because there's a convergence of the two diseases where somebody has an underlying condition and then additionally they can get the infectious disease that are caused by viruses and bacteria.
All right.
Beyond that, there are additional vaccines for different occupations. For example, people who are in healthcare occupation are recommended to get certain vaccinations to protect them because of conditions that they can get in the workplace. For example, hepatitis B vaccine, as well as even seasonal influenza vaccine. So those are just some examples of vaccines that need to be given within the lifetime of an individual. And we should not only think that vaccines are for the children. Each of us should actually get vaccines that are appropriate for our age group, depending on different conditions that we may have.
Right. Right, Dr. Marybeth, and quite important that you actually mentioned this, because a lot of people believe that vaccines are only administered to children alone. And, well, in the essence of reducing the burden of infectious diseases, Dr. Evans, to what extent has the COVID-19 pandemic affected the routine immunization exercise that is currently in place here in the country?
Thank you so much for that for that question. We actually there's a lot of services went down during the COVID-19. The outpatient visits went down, other inpatients actually went down, and vaccination went down. The figures that are there is ranging from anything up to about 20% probably of people never turned up for their vaccinations, and this could lead to a large number of children who could probably lead to some diseases in future. There could be outbreaks because if the herd immunity goes down, then it could be outbreak of other diseases. So it's a big thing that we need to do now is a catch up, so that we can be able to get all those who missed the vaccinations can be vaccinated. The figures of how many people have been vaccinated are out is not very clear, because there have been issues with the figures we had with the census that we had. So if we use the census, it looks like we are doing well despite the numbers going down. But I think the numbers probably could be much higher, the ones who are not being vaccinated.
Right.
So the vaccination, the certain diseases that have actually kind of like gone down. When I was young as a medical doctor, we used to have what we call measles ward, with people coughing and unable to breathe and all kind of things. That kind of diseases have actually kind of like disappeared. We do get a bit of measles kind of outbreak, but not as bad as they were before. So we still insist that if all the parents who miss the vaccinations, please go back for vaccinations. There could be other people who are probably discussing negatively about vaccines. These are not true. There are other things that could be for vaccines, but then the disease themselves are usually much worse than any than most of the side effects that we get from vaccines.
And we'll come back and discuss a little bit more on some of these misconceptions on vaccination. Let me get to you, Dr. Rudy, now. Now, the World Health Organization has been working with countries and has partnered to improve the global immunization coverage. Maybe just give us a glimpse or an idea into the Humanization Agenda 2030 and what it seeks to achieve.
So thank you very much for allowing me to take part in this. So the World Health Organization recognizes immunization as one of the great achievements of public health. It is really one of those things that make a huge difference. We know about the epidemic diseases like measles and polio, and of course smallpox that was eradicated by vaccines. But not only that, really all the other vaccines that we have really deal also with the childhood diseases such as meningitis. And now, of course, we've got a malaria vaccine that is being tried out in Kenya. The agenda that WHO has is actually providing for the countries to increase the routine coverage. So the first and main strategy is make sure that every child that is born along the normal first year, second year of life, they get all the regular vaccines. And as was mentioned earlier, as they get older, there are other doses that are given as appropriate. And our first strategy, first target is really to make sure that these rates of coverage go up. In Kenya, we've got coverage that reaches about 88%, fluctuates from year to year. It's a little bit stagnant over the last 5 years, but the first purpose really is to make sure that the immunization coverage goes up. In some of the diseases, it's actually necessary to add immunization campaigns, so where you do an extra effort to reach everybody at the same time. Most prominently, and as Kenyans know, we've been doing this for polio, so the polio eradication program has been doing polio vaccination campaigns. Frequently they come in twos, so 2 campaigns a month after each other. The last one was just last year in some of the counties because we were concerned about virus coming in from Somalia. But then also measles and rubella, actually we do campaigns to make sure that everybody gets immune at the same time. And then just recently we had meningitis A vaccine being given to everybody between 1 and 29 years of age in the counties that are most at risk. These are the northern counties for meningitis. So that is the second big target, is to make sure that we do these campaigns. Added on to that, of course, it's very important to measure what you are doing. So the surveillance for the disease and the monitoring of how vaccination is being given is really important. That is another component that one normally doesn't really associate with the act of giving vaccines, but it's equally important. Vaccines are biologicals, so they require a cold chain. So getting the vaccines distributed to all the facilities where they are needed is a big task, and requires that the vaccines are kept cold throughout.
All right. Thanks, Dr. Rudy. Now, Mr. Sami, let's just talk a little bit about, the healthcare system in many African countries, specifically here in Kenya. Now, we're still lagging behind in terms of the budget allocation that is usually given to the healthcare system. Now, in Kenya, I think we're about 7% or out of the recommended 15% budget allocation from the national cake. But looking at it that way, how has this impacted, our focus in advancing research, specifically in vaccine development?
Thank you, Najma, and thank you for the question. So generally, the development of vaccines is a collaborative effort. It's collaborative effort between research bodies, organizations that fund the research, universities, and even institutions such as Cambridge that Dr. Amukoe works in. This collaborative effort, so not a single entity really can solve all the vaccine-related challenges that are there globally. Today, for instance, we have 26 diseases that are already vaccine preventable, so for which a vaccine exists. But there are 20 other diseases for which research is ongoing. And this is what I said, it's a collaborative effort between the funders, between universities, and between R&D multinational companies, research and development multinational companies, such as Sanofi Pasteur. So, and I think that there is no better illustration of the collaborative effort of making vaccines than is currently happening in COVID. Mm-hmm. So obviously, are we doing enough? Maybe we could do more to be able to. We could do more to be able to quicken the research. But I can say that I mean, from a global perspective, there is plenty of collaborative efforts, including even research organizations based here in Kenya that are working towards us getting vaccines faster.
Mm-hmm. All right.
Not necessarily. Mm-hmm. I mean, the provision of vaccines should not just be seen as the last step of manufacturing, mm-hmm. but then there is a long way before we actually can get a vaccine to immunize that adult or that child or that vulnerable person that requires a vaccine. Right. And it is a lot of things happen behind the scenes that mm-hmm. are very, very collaborative and global in nature.
All right, Sami. I'd like to rope in Dr. Evans on this particular conversation. In terms of the capacity to develop and manufacture vaccines locally, where are we at? And is there hope for the future for us?
Thank you so much. We can start from very many areas. We can start from R&D. We have the capacity at R&D. We have the capacity to actually probably have some factory and manufacturing, and we have distributed. I mean, it's a whole system. Mm-hmm. We at the moment there is a committee that was formed by the permanent secretary, Minister of Health, who actually gave KEMRI the leadership to do that particular work, and we have brought in a lot of people to look at the landscape of vaccine manufacturing within the country. Mm-hmm. So that when people come here, whichever company, whether it's local or outside that comes to manufacture here, will have a proper area to work in. So we have brought in a lot of people. That is people from the University of Nairobi, mm-hmm. people from Ministry of Health, people from ICT, people from Konza, the Konza city, and many other people. With that one there, we actually have preliminary information that shows that we have the capacity. There are issues that we need to do. There are legal issues that we need to improve on. Mm-hmm. And we are looking at things like at the market, so that we have a huge market, because if you have a small market, it may not be worthwhile producing a vaccine within the country. So if you start producing, we might have to look at regional rather than in individual country. Mm-hmm. But the reason now, the urge to start producing vaccine locally is now very heightened for several reasons. One, we are being said that we are a richer country now, Kenya, and therefore the support from Gavi is going to wane and go down, and therefore we might have to start buying all the vaccines. Right now, we're getting a lot of support to buy vaccines, so mm-hmm. we have to start thinking about it. And the second one is the COVID-19,
yes,
which showed that probably bringing in materials from outside when there is an epidemic or a pandemic could be a problem. In fact, one of the biggest fear we were wondering was not COVID. We have been discussing with many people, including Sanofi, and what we are preparing for was flu. Mm-hmm. And the idea was probably to make sure that the capacity that is there worldwide is enough. But can you imagine the capacity is not enough? Then it will mean that where the mother factory is where they will send the vaccine first. So it is something that we need as a country to start looking, because it's a strategic thing that we should be having capacity to develop it. If you look at vaccines development, it's a whole thing. It's from the innovative area that we used to do very work there, but now doing work on it in terms of producing antigen, and then it comes up to things like phase 1, phase 2, phase 3, phase 4. Those are areas that we have been involved much more than the earlier phases. So mm-hmm. if you look at diseases like malaria, we're involved in it. And if you look at TB, I've done a lot of vaccine trials on TB. Unfortunately, they have come to naught, but we are not giving up. And many others, even Ebola, we did the Ebola, the vaccine that's being used for Ebola was actually done, part of it within within the country.
All
So
right.
the downstream research, we are very good at it. The upstream research, we are now working on it.
All right, Dr. Evans, I think on that note, and we will be expounding on that a little bit more as we hear from Dr. Rudy as well and Dr. Mary Beth. We're going to take a short break, but when we come back, we still have a lot more we will be covering. Stay with us. All right, thank you so much for staying with us. You're watching the Nation Leadership Forum, and today's topic is on vaccination in a pandemic era. And before I get to Dr. Mary Beth, who is an infectious disease and travel medicine expert, let me just get sentiments from Dr. Rudy, the WHO country director, on the financing aspect of vaccination and immunization among African countries. Now, Dr. Rudy, do you feel that African countries can do more in terms of financing research on vaccine development?
So certainly, I think African countries can do a lot more in terms of development of vaccines and production of vaccines. Some countries in Africa have already started. Normally, they start off with just the filling process, so taking bulk vaccines and then filling it. But with time, actually, the production can be actually done in country as well. But let's get to the financing of the vaccines. Currently, African countries could do more also in terms of paying for the vaccines that they use. There are a handful of what we call traditional vaccines that are actually quite inexpensive. And these vaccines traditionally would be funded by the governments. Since approximately 2001, there has been the Global Alliance for Vaccines and Immunization called Gavi, which is a partnership among international agencies such as WHO and UNICEF, vaccine manufacturers, philanthropic organizations such as the Gates Foundation. And they've come together to support the funding of immunization. So many of the newer vaccines that actually were quite expensive have been subsidized through the Gavi Alliance. So that has enabled Kenya and other countries to introduce vaccines such as pneumococcal vaccine or indeed human papilloma vaccine that was mentioned a bit earlier. So these vaccines have all received the support of Gavi. But in addition to that, of course, there is a component that the government still has to pay. So Gavi doesn't fund the vaccines in full total, but the government co-finances some of it. This will be similar for the COVID vaccine. So the COVID vaccine that is being prepared worldwide that was mentioned earlier, there are several candidate vaccines, and they too will be supported by Gavi for countries such as Kenya.
All right, Dr. Rudy and Dr. Mary Beth, even if you would like to add a little bit more in terms of financing, if you would like to probably add on to that, your sentiments are welcome. But before that, travel medicine will change completely in the pandemic era. Maybe also give us an idea on to how this will look like in the future.
So I think COVID-19 has changed our lives. And going forward, our lives will never be the same again because of the pandemic and the consequences of the pandemic and the fact that this has been a global emergency that is of respiratory origin. I think this could be what was envisaged as disease X. This is disease X for now. And in future, there will still be another disease X, whereby disease X is something that is unknown and becomes known with time. So when we think of travel medicine, really, this is an area of expertise where you look after people moving from one area to another area. So it can be within the country, or it can be people who are traveling from one continent to another continent. So when we talk of travel medicine, and we normally use vaccines to try and prevent some of the infections that people who are moving from one geographical area may be at increased risk because of moving to another geographical area by virtue of that some of the diseases may be endemic to where the traveler is going to. And therefore, that gives us an opportunity to offer vaccines to prevent diseases. And maybe once we have the COVID-19 vaccine, then it can be able to prevent transmission of the disease for people who have not already been infected. But one of the things that we know with COVID-19 now, and maybe even with other respiratory illnesses, like, for example, the seasonal influenza, you can get infected many times in a lifetime. So even when you get a vaccine this year, for example, for seasonal influenza, if you miss your vaccine next year, you can still get the infection. So within travel medicine, we normally use vaccines to prevent diseases, and we look at these vaccines and classify them into three main categories. So you have vaccines that are required by certain agreements. For example, the International Health Requirement of 2005 categorizes yellow fever vaccine as one of the vaccines that is required for travel, and different jurisdictions therefore put in place a requirement that if you're coming into my country, you need to provide certification that you have received the yellow fever vaccine. The next category of vaccines is what we would consider as recommended vaccine. And these are vaccines where, as a travel medicine expert, I can recommend to a traveler who's going to a geographic area where those diseases may be endemic. And I'll give an example. If somebody is traveling maybe from the US and traveling to the Indian subcontinent, one of the recommended vaccinations would be hepatitis A vaccine, because it's very endemic in that particular setting. And what we know about hepatitis A is waterborne. It's transmitted because of drinking water. And therefore, going to that setting where the disease is endemic puts you at risk. The third category within the travel vaccine is what you call routine vaccination. And we use the travel opportunity to update the person's vaccines, so that you're looking at vaccines that are important in a lifetime. And this is a time when you can give some boosters. So an example of that is if somebody, for example, is coming from the US, coming to Africa, some of the booster vaccines that would be recommended for that person would include things like polio vaccine, where you can give them an injectable polio, a dose. You can give them also tetanus vaccine, because they're coming to this setting and they can easily get a cut and get the tetanus infection, because some of these antigens, even when you receive them, some of the vaccines, when you receive them in childhood, they wane over a lifetime, and therefore you need additional boosters to boost the immunity and ensure that you have adequate protection. So we categorize the vaccines as required, recommended, and routine. Another required vaccine that I forgot to mention was, for example, for travelers going for Hajj, one of the required vaccines is actually meningococcal vaccination, because when you read the history of meningococcal outbreaks, during Hajj, there's convergence of a lot of travelers coming from different parts of the world in Mecca for the pilgrimage, and therefore it puts the travelers at risk of getting meningococcal meningitis because of convergence, and that people have this bacteria normally in the back of the mouth, in the throat, and therefore you can get outbreaks. So one of the requirements by the Saudi government is that all pilgrims traveling to Mecca for pilgrimage should actually get meningococcal meningitis. So within that requirement, then you have two vaccines. We have the yellow fever as well as the meningococcal vaccine. So that is just in brief the role of vaccines within travel medicine. And we know that for COVID-19 particularly, part of the only protective mechanism now that we currently have is really to follow the public health measures that are there. So hand hygiene, socially distancing where possible within the aircraft where you're thinking the risk could be high. And I know some aircrafts have put in place things like the HEPA filters to purify the air, but even hand sanitization, and more importantly, even wearing of the face mask during the journey, because you have people sitting together within the aircraft, and therefore that puts them at risk that you can have an outbreak. But many of the things that have been put in place by the airlines, therefore make sure that that conveyancy through travel in the aircraft minimizes the risk for the travelers until such a time when we have maybe vaccine that will work to minimize the risk, and will add it to their armamentarium to prevent COVID-19 as part of travel medicine.
Right.
Thank you.
Mr. Sami, you know, the travel restrictions that have been imposed by, you know, governments and other public health measures that have been put in place because of COVID-19 has definitely affected the vaccine supply chain globally. Maybe just give us an idea as well into some of these implications on the supply chain of vaccines.
So, Zainab, as you've rightly put it, when COVID happened, because apparently COVID didn't come, COVID happened, there were disruptions everywhere. Practically every sector, service, industries, manufacturing, all of them were impacted one way or the other. However, the greatest impact that was there on the vaccines was that as soon as countries closed borders, many of the vaccines, as it were, all of them, are cold chain items requiring that they have a cold chain that should not be broken from manufacturing to the time the patient gets the vaccine. And so they have to be ferried in special pallets. And normally this would come in commercial aeroplanes. Commercial aeroplanes meaning that the passenger flights would account for the bulk of the vaccines delivered to different countries. And Dr. Rudy can also attest to this. So with the suspension of passenger flights, no doubt, so we now had to only depend on cargo flights. Now, cargo flights would not have the same frequency as passenger flights as we would expect. So there was a disruption, but thankfully with time, some countries obviously were luckier than others, depending on how interconnected they are, how bigger the hub, the capital city would be. So in the case of Kenya, with tremendous, of course, initially in March and April, and part of April, there were challenges and delays and a few out-of-stock situations. But then the situation normalized as we got more and more cargo flights to be able to deliver the vaccines. The pandemic also resulted in increased demand for some vaccines.
Right.
And to Dr. Maritim's point, for instance, the seasonal influenza vaccine, of course, the global demand certainly increased because people did not want at one point to be at risk of influenza, which is vaccine preventable, and COVID at the same time. So, of course, the global manufacturers had also to ramp up production to ensure that everywhere where the vaccine is required, it actually did get there. And I think I can attest to the fact that Sanofi Pasteur, having been producing vaccines for the past more than a century, to the greatest extent, vaccines have been able to reach the people who require them.
And I'd also like to rope in now, Dr. Rudy, on the same as well. The supply chain, the vaccine supply chain has been strained quite a lot. Then this has definitely impacted the immunization agenda that WHO is working towards.
Surely, as was mentioned a minute ago, the supply chain was one of the key factors or key aspects of the pandemic initially. So when flights were stopped and travel restrictions were put in place, it actually impacted the entire global delivery mechanisms. I think for vaccines it has been resolved. As was mentioned, within a month or so the vaccines have been delivered to Kenya and to other countries. So that matter in itself I think is resolved now. It still has to be managed though, so going forward of course flights are not back to normal. The shipment of vaccines and other commodities, including the commodities for the COVID outbreak itself, are still under strain. But I think we're learning quickly on how to do this properly. So at the moment, there should not be a situation that the country such as Kenya does not have sufficient vaccines.
Now, Dr. Evans, a lot of our viewers are very concerned on a certain subject. You did touch on it, but we'd like you to expound a little bit more on that. And it is the race towards developing a COVID-19 vaccine here locally. Give us a clear picture of exactly where we are as Kemri.
so much. The vaccine that we are just about to start doing research on, actually, we have got all the approvals, and we are now beginning to recruit, is a vaccine that was developed with Oxford University, which are working together with our team, one of our teams in Cambridge at the coast. And it is actually to find out whether the immunogenicity, the safety of that vaccine. And so far, in the earlier study, showed that it's working very well. And the thing is that we are so cautious about it that if you get one severe adverse event, that means that you are admitted in hospital, you die, or something serious happens that affects you. We stop this study immediately, whether it's vaccine related or not, whether you're knocked by a car, whether you had some other problem. We have to stop it, investigate, and find out the reasons why. So that vaccine, once it shows it works, we'll move over to the next phase 3, and then probably get it registered. Now, the things that people have got fear that we are being experimented on.
Right.
And yeah, the thing is that all the drugs and vaccine, we have got to do research on it, and we have got to make sure that it works before it. And many times when you do research, I do a lot of research more on other medication other than vaccines, and I can assure you that sometimes when you try some of those drugs, we find out that even the ones we are using probably have got more severe effects compared to the ones that are there. But generally, we look at all of it, and then we can do the analysis later and find out whether this one is safer and whether it works better or not before it's used. That's why when people jump and say that the vaccine works and they want to start using it, before it goes through the stages, we get very, very worried, because we look at all the effects, whether it is blood, whether it is liver, whether it is kidney, the heart. We look at everything that possibility that the vaccine can cause. And by and large, the side effects of vaccines are much, much lower compared to the disease itself. So we hope in the next few months, after we have recruited, we'll start seeing some results and probably see whether the vaccine works or not. If it works, then we move on to the next phase 3.
All right.
Which is now a larger.
Quite in a larger proportion now. And Dr. Mary Beth, this is quite an issue that has attracted a lot of sentiments, diverse views on the same, that the African population is being used as guinea pigs in the vaccine trials. To what extent will this impact our, our efforts towards being able to be a frontier in the healthcare system, not only in Africa, but globally?
So I think while it's a genuine concern, one of the things we have to remember is that somebody has to do this work.
Right.
This work has to be done somewhere. It has to start somewhere. And I think in Africa, we have been fortunate where we reap the benefits of something where we have not sowed anything. And therefore, we have this sense of we are always benefiting from others' efforts. And I think it's a high time we change that mentality, because we have to start somewhere. And I think one of the things I want to let the audience know is that before these clinical trials come to Kenya or to Africa, one of the requirements internationally is that the clinical trials have to be started in the country of origin of that vaccine. And we had Dr. Mkoe mention about the partnership with Oxford University. This vaccine has been tested in the people in Oxford before it can be tested in the people in Kenya. And therefore, we need to have that security that we are not just guinea pigs. We are part of the global community contributing to the scientific knowledge. So I just want to say a few things about the stages of the process of even developing the vaccine before we can get a full vaccine that is working and licensed. So Dr. Mkoe mentioned this, but I just want to emphasize, we have phase 1, we have phase 2, we have phase 3. And then after that, you have licensure, and then you have post-market surveillance, where even when you introduce the vaccine, you still have to monitor for any side effects within the population when you're giving it to very many people. So in phase 1 trials, you're actually looking at the safety and what we call the immunogenicity. Is the vaccine able to raise an immune response that you're looking for? So you have to have ways of measuring that immune response and know that it's the one that will protect against that infection. The second phase, which is phase 2, you're looking at a larger population, again, in the immune response, and you're looking again at side effects. So again, related to safety and immune response and potential side effects. So again, this is about 100 people. You move from maybe 20 people to 100 people. And then in phase 3, you're giving a larger population and you want to see the efficacy. And when you're talking about efficacy, you want to assess to what extent is that vaccine protecting against that disease that is supposed to protect against. So you actually want to test and see that it's able to offer maybe 50% protection, 100% protection, 90% protection, and you're able to measure that protective effect. So once a vaccine has gone through all those phases and it meets the threshold that has been set, it is safe, it's immunogenic, it can elicit an immune response, and it's efficacious, then it can proceed on to be licensed. And it has to be licensed in that country of origin and then licensed globally. And there are regulatory bodies like and other oversight bodies like WHO, American FDA, European Medicines Agency that are able to provide that sort of regulatory oversight to ensure that vaccines that are available are safe.
Right.
And I know many people would be anxious and say, oh, maybe it's a different vaccines, but there are certain regulatory safety measures that are put in place to ensure that the vaccines are safe, and those same standards would be applied in the West, just like they are applied in Africa, as well as even in Kenya specifically. And within Kenya, the Pharmacy and Poisons Board is a regulatory body, together with the National Council for Science and Technology, NACOSTI, that provide that oversight when clinical trials and vaccine trials are being undertaken.
Right. Thanks, Dr. Marybeth. And I think you touched on a very important point, and we can all share and we can have a discussion around this, which is definitely on the safety of the vaccines, with misconceptions about the vaccines, about having shifted from public focus away from the benefits and towards distrust in science and a fear possible of, side effects. And one of the, key issues that have come out in the recent past is the fact that some of these vaccines are meant to interfere with the sterility in women, as well as, hinder, population. Mr. Sami, I would like you to chip in on that as well and just give us an idea as to how we can be able to counteract this distrust, these misconceptions.
Thank you, Zainab. The response to that question about supposedly vaccines having an effect other than that which they are primarily meant for, we could also tie them to what Dr. Maritim has talked about. And I also wanted just to emphasize the fact that the pathway to the licensure of a vaccine is a multi-site, multi-country, broad-based research process. It is such that it is not possible to simply register a new vaccine that has been tried and tested only in one country. And therefore, for instance, if there is a country that has been used as a site, as a center to test a vaccine before licensure, in Africa, it would only be a representative of Africa together with many other global sites spread across the globe, just to be sure that, remember that the vaccine upon licensure should be able to protect everyone. It is meant for everybody. It's not just meant for those ones for which it was tried on. So it is a multi-country, multi-site, multi-center based approach to before a licensure can be obtained. And similarly, for the perception that a vaccine may be meant to achieve another ulterior motive other than that which it's supposed to protect against, that cannot be the case because, again, the vaccine would not just be used in our country, for instance. We do not have just a vaccine that is made for use in Kenya only. It is used globally. So then you would expect that if there was any such possibility, it would be globally spread. It would not be in one center or in one country or in one part. It wouldn't be. Having said that, as working for a company that is truly, truly devoted to ensuring that no one suffers or dies from a vaccine-preventable disease, and has been doing this for more than a century, more than 100 years, I can attest to the high quality of vaccines. To Dr. Mkoe's point, the high quality of vaccines to the extent that we, as manufacturers and innovators, realize that vaccines, for the most part, are given to healthy people. And healthy people will not withstand side effects. They will not withstand the discomfort coming from vaccines, considering that they were already well before they took the vaccines. So out of production time of vaccines, even post-licensure, after it has already obtained a license to be able to be marketed globally, 70% of the production time goes to quality control.
Right.
Just to ascertain how safe and efficacious that the vaccine will elicit nothing other than that which is supposed to protect the patient from.
All right. Thanks, Mr. Sami. And we'll definitely be hearing from Dr. Rudy as well as Dr. Evans on the same. We'll be taking another short break here on the Nation Leadership Forum. Stay with us. All right, thank you for staying with us. You're watching the Nation Leadership Forum on vaccination in a pandemic era. Otherwise, you can be able to reach us on our social media platforms at NTV Kenya, at Zainab Ismail. The hashtag we're using tonight is NMG Leadership Forum. You can be part of the conversation. And I'll get to you, Dr. Rudy, right now as we wind up the discussion on the safety of vaccines. I can see a viewer at Andy saying, there has been a debate that autism can be caused by the use of vaccines. Is that a true fact? And as you give us an answer to that, remember there are some religious affiliations and groupings within the country that have in the recent past even called for a boycott of some vaccinations, still saying, you know, some of these issues are not in alignment with what we believe in. So then how can we begin addressing and prioritizing communication to offset this level of public distrust, public health distrust?
So thank you for that question. It's the immunization group takes safety very, very seriously. As it was mentioned earlier, immunizations are actually quite different to medicines. So medicines we give to people who are ill, who need a specific medicine to make them better. So they are requiring this medicine. Vaccines is different because you're trying to give it to almost everybody, every child, every teenager that needs to get to the vaccine. So the target group for a vaccine is vastly bigger than for medicines. And for that reason, we pay a lot of attention to the safety. So normally a vaccine goes through many, many years of trials and many years of safety trials. The World Health Organization has got a committee that looks at the safety of vaccine in great detail and is very, very careful to deal with conflicts of interest. So we allow our experts to be, only those experts that are truly independent are actually included in these panels. So we are reasonably sure that the advice that we are getting and the opinions that are given on the vaccines are true. Mm-hmm. In terms of the misinformation about autism being caused by a vaccine, this is information that came from a false publication by a doctor in the UK, and it was withdrawn by the publication as being shown as being unscientific. Mm-hmm. It also meant that that doctor had been removed from the register of the Medical Council in the UK. In fact, there's ample evidence. Vaccines are being given to many, many millions of children, and the relation to autism has been proven not to be the case. There are many other rumors, and they are mostly false about what vaccines can do. Clearly, vaccines do have side effects, and we are aware of those and look out for those. And in fact, if people sense that they have a side effect from vaccines, they get investigated quite carefully. There are teams that go out, investigate if there's any truth to that rumor or that allegation, and there are committees in place, even here in Kenya, that look at the truth or the science behind those rumors. So we are very, very careful with the safety of vaccines, and I can assure Kenyans that the vaccines that are currently in use in Kenya are truly and totally safe. There's no doubt about them.
All right. Dr. Rudy, before I let you go, in the context of COVID-19, away from the safety issues, is another issue, and which is the fact that caregivers are now being a little bit hesitant in terms of heading to healthcare facilities. And this is affecting, immunization among children in the country. So then how do we begin to ensure that children don't end up suffering from vaccine-preventable diseases?
Yes, that is a great concern. It was mentioned earlier. Fortunately, it seems that in Kenya, that while we did have some decline in vaccination coverage in April and May, it seems that it has recovered somewhat. So it is back to the level that it was in 2019 and 2018 in terms of the number of children vaccinated. But that is, of course, a great concern. If caregivers have got concern going to health facilities because they fear either being infected with COVID or for some other reason, that is a great concern. The Ministry of Health, together with its partners such as WHO and UNICEF, have instituted a group that looks at maintaining the essential services for public health. And immunization is, of course, a very important part of this. Clearly, there are other public health programs, such as malaria program, the HIV treatment program, tuberculosis, and many other programs that also have to be maintained. And for all of these, we've been in contact with the counties and through the health ministry to the health facilities to make sure that these services actually continue to be given. And it seems that we are finding that more and more of the population are finding comfort that these services are still available and that they can access them at the regular health services.
Right. Thanks, Dr. Rudy there. Now, Dr. Evans, when it comes to the extent to which the monitoring of immunization across the counties is happening, and other essential services such as maternal, antenatal care as well, do we have a constant monitoring system that you are aware of? Dr. Evans, you can hear me,
they are the
right?
normal government. Yeah, they are the normal government systems where we get all the information about what's happening in the periphery. We do have meetings with even the people who are immunizing people on the ground. There is a group, there is a whole unit within the immunization program that actually looks at side effects and all those kind of things, so that we can know what's happening on the ground and who is being immunized, who is being left out, what side effects do people have, so that we can be able to see what is there. I'm sure we could improve on it, but we do have those things, and occasionally we do, a few surveys are done to see really what is happening on the ground. But something else which we discussed about the different constituency,
right,
like the Catholic Church that was against this. What we do now is that before we introduce a certain antigen, or when we do some of those campaigns, we have actually included them as part of stakeholders. So they are on board and they are comfortable by the time we're going out, that there's nothing that we are doing that is hidden. Everything is on board, and everybody knows what we're doing in that particular area there. But right now, things like the data that's collected, we do get it. We've been shared. As you know, me and Mary Beth is actually my vice chair in the advisory committee of the government on vaccine. We do get information from the government to see what's happening in various counties, and we do give our advice accordingly. Thank you.
Right. Now, Mr. Sami, when it comes to the development of the COVID-19 vaccine. So there are concerns that, there are different strains of COVID-19 across different areas in the world. So let's say, for example, that a country in Europe manages to develop this vaccine much faster, and this vaccine has to be distributed across the globe. But then there are factors that come into play, for example, environmental factors, which mean that our strain is quite different from that in Europe. So then how do we ensure that we are able to also be part of this vaccine development and also be able to get a vaccine while it is developed somewhere else?
I think, thank you very much for this question, because in the end, the question actually makes it very clear why the development of vaccine is a global effort, it's a collaborative effort. It takes everyone into account. Before licensure of the vaccine, it has to be tested in different parts of the world. So that's why I come back to the same point. The vaccine licensure pathway is multi-center, multi-country, so that then it can be generalized globally. The way the viruses and bacteria work, however, it is such that we all know today where the disease first originated and how it has spread globally. The reality is that it is the same virus. Now, the vaccine being developed will be general in nature such that, to the extent possible, it actually covers any minute mutations, not shifts, of course, not dramatic shifts so that we have a completely new coronavirus vaccine, virus. But as long as it is COVID-19, and considering how broad-based the research on the vaccine is going to be, considering also, and I can speak this on for Sanofi Pasteur, that the company has been producing the vaccines that have been working for more than 100 years. Let's look at rabies, which has been proven to be 100% effective. Let us look at polio virus vaccine, which has worked and eliminated 99% of polio disease. There is no doubt whatsoever that the vaccine that will come out, when it does come out, will be able to protect everyone globally. It has been done before with smallpox. It has been done with polio. It works with influenza. There is no reason why the vaccine that will come for COVID will not work for everyone.
All right, thanks, Mr. Sami. And maybe just to get last remarks here, Dr. Marybeth, as you make your closing remarks, where do you think we're headed as a country in terms of, being a leader in humanization and vaccine development? Your closing remarks, very briefly.
I think we have had a lot of deliberations in this forum today. And I think particularly for Kenya, we are in that defining moment because about 2 or 3 years ago, we became a middle income country. And therefore, even we are progressing upwards and would be graduating from Gavi's support. And therefore, for us, we need really to ask the government to do more and invest more in terms of vaccine manufacture within the country, so that when the cost is too high, we're able to manufacture the antigens locally. So we need to provide more investment within the country to be able to manufacture some of the antigens locally.
All right. Thanks, Dr. Marybeth. And Dr. Evans, also very briefly, your closing remarks as we celebrate the eradication of polio, by the way, in Africa.
Thank you so much. The last one, actually, we found it from a Siwa, and it was actually vaccine-related polio. So actually, we have not had polio for a long time. We, on the same question you had asked my colleague, we actually have done about 600 gene sequencing and deposited 122 in the gene bank. So when they're going to make any vaccine, we'll be having our information about what's happening in our place. If you look at flu, which we discussed on, we actually give our samples so that those samples actually go to what the WHO uses to try and advise the companies on what to do. So the vaccines that we do have are actually, they do affect us. There was one that was pneumococcal early on that was not covering a lot of our people here. But we had a bit of argument with our colleagues, and they told us that even if it's going to save 40% of lives is better than 40% of lives dying on a daily basis.
All right, thank you, Dr. Evans. And finally, Dr. Rudy, also very briefly, your perception, 10 seconds actually here from my director, on how we can be able to achieve what we attain, and of course the vision that WHO has in terms of humanization.
So thank you. I think the most important thing that I'd like to say at the end of this is it's very important for mothers to bring their children, or caregivers to bring their children for the routine vaccines. They still work, they are safe, and they actually protect children quite dramatically. So if there's one plea I could make is please continue to be vaccinated. If you are a small child or teenager, or indeed, as was mentioned, the elderly or seasonal flu, all of those are really important measures, so please keep it up.
All right. Thank you so much, Dr. Rudy Eggers there, the WHO Country Director, Dr. Evans Mukoye, the Deputy Director, Partnership and Collaboration at the Kenya Medical Research Institute, that is KEMRI, Dr. Mary Beth Maritim, who is an infectious disease and travel medicine expert, as well as Mr. Sami Ndungu, the head of Sanofi Pasteur Vaccine Eastern Africa, who, by the way, one of the sponsors who managed to give us the opportunity to have this conversation. So thank you so much, lady and gentlemen. And the conversation ends there, but we will be having it on our social media platforms, so you can continue sending in any questions or messages that you would like to get answered from our panel. The hashtag is NMG Leadership Forum. My name is Zainab Ismail. Thank you once again for watching. The news update is coming in just a moment with Mark Masai. Stay with us.